I'm Emma. I'm Dr. Emma Phillip. I am working here at Colleges Crossing, and I've been here for 6 months now, pretty much officially 6 months. I'm a Kiwi, so don't hold it against me. I trained in New Zealand, trained in Dunedin, went to Otago Medical School, followed by working through the hospital system for a few years before having a break and having kids. And then I did my GP training here in Queensland. So I do work part-time. I think GP works really well for me from a work-life balance. I have two nearly teenage children, so life is kind of hectic. I work 2.5 days in GP, and then and that's kind of flexible as well. Depends on your workplace. If they need me to work more, I'll work more. If I need to do kid stuff or something for myself, I can adjust that around as well. I at one point decided that I wanted to try a different direction, but still working in GP, but I decided that I wanted to do some cosmetic medicine as well. So I went down that pathway for a little while. Ultimately decided the cosmetic side of things wasn't really for me, but within that industry I had started doing some vaginal laser for postmenopausal atrophy, and also nipple tattoo for post-breast cancer reconstruction. So very niche little area, but I work 1 day a fortnight in a clinic doing both of those things. GP is really good for, I guess, experiencing everything, the whole broad array of issues and problems that people have, and you can, by being exposed to all of that, you can decide what you like and what you don't like, and you can actually taper your patient population somewhat as well. If you're really good at listening and like a bit of mental health, you can quickly get a reputation for being good at that and fill your day up with mental health. Or you can get a reputation for not being very good at that and not do too much of it. So GP does give you that ability to, although you're still general, to try and hone some skills. A lot of GPs I know have really subspecialised in skin and do huge amounts of minor surgeries within their practice, and really enjoy that, but also enjoy having the variety of seeing patients for other problems as well. For me, actually the relationships, and that's really weird to say because I've just left my practice of 8 years and joined this new practice, and it's probably the thing I miss the most, is knowing my patients inside out, and knowing whose child has just won state level swimming or something, like, and being able to start that conversation before they come in the door. Okay, I have been fortunate. I've moved half an hour from my last practice, and a good chunk of my patients have followed me. But yeah, that's probably my favourite part. I moved from the last practice for probably a couple of reasons. One, we were moving house, so physically it was going to be a drive back to my old practice. I'm still driving half an hour to my current new practice, so it kind of made it, well, it won't matter either way, it's going to be a drive. Tony and Kat, who own this practice, are friends of mine, and I've seen them build it from the ground up, and I've seen how hard they work, and I've seen the staff that they have behind them, and they've remained very stable over the last 4 years. So to me that was a really big part of just knowing that they had good people working for them, and they were obviously treating them well as well because they were staying. My last practice, look, it was a great practice, served me really well for 8 years. I had actually the hardest part of leaving there was because of my patients. I had built up those rapport, and I was actually dead scared to tell them I was leaving. But I didn't have my own office. I changed rooms every day. Just some little factors there. So here I get my own room, ergonomically, sit, stand, desk and chairs, and it's really, if there's anything, if I mention, I have a few neck issues, but if I mention something, Tony's always like, oh, is there something else we can do? Is there some other way we can help? Or if you say, Friday, I've got to go to some presentation at school in the morning, they don't want to know about that. They just say, just block it off. We don't want to know. Manage your books. Yeah, probably the best, my most favourite thing that I've ever done, and this is not in GP, but I think GP will wind me back in this direction, is palliative care. Working in a hospice was just, sounds crazy, but the most ridiculous, most rewarding job. And I ultimately, once my kids get older and I don't have to be as committed at home, I would ultimately like to probably find a pathway as a GP. I can think of individual things. Probably one of the worst thing that's happened to me was I had a, how old were they, about 6-year-old die, which was horrific. Not my fault in any way. I was at in GP, so not in a hospital situation, in GP. I was at the tail end of the care, basically just the very sick child, ring an ambulance type of thing. But yeah, getting the phone call from the paediatrician the next day was horrendous. I saw this question written somewhere the other day. I didn't pay enough attention. So top 3 tips for being a good GP, I think, is 1, look after yourself. Okay, you can only be so many things to so many people, and you can only do so much. And once you get that attitude, your life becomes easier. Okay, some of our days here are crazy, and we run half an hour, 40 minutes behind. And you know what? You can only do what you can do. Okay, and as long as when each person walks into the room, it's their time. They may have waited half an hour, but now they've got their time and the focus is them. So, but you've got to just have that attitude. You can only do what you can do. Second, another tip would be if you're going to go home and worry about it, you didn't do the right thing. So if you think, I'm going to go home and worry that maybe that guy was having a heart attack and maybe I should have sent him ED, or I should have done an ECG, or should have done it well. You should have. Don't go home and worry about it. If you're going to worry about it, do it now. Okay. You might run half an hour late, but it doesn't matter. And if you give someone the first, I don't know what the actual official time is that people say, but if you give someone a good minute to just talk when they first get in here, you'll learn so much more than firing questions at them as to what you think they might be there for. So let someone talk and listen to them.